Hi there from Mexico, this is Fernando De la Torre and I am very thrilled to participate in this edition of the Young Actuaries World Cup. And before sharing with you my idea, I would like to tell you a little story. Very early in my career, one of the greatest mentors I've had once told me, Fernando, actuaries are like Spider-Man. Of course that the first thing that came to my mind after hearing such an idea was something like this.
Hulk's liability costs are off the charts again. With great power comes a great deductible.
Of course, my mentor quickly stopped my fantasy about Spider Actuary, which by the way would be a great movie, and told me that he was not talking about that. He was talking about the fact that actuaries possess a great gift, a great intellectual power by being able to predict the implications of certain types of risks and generate ideas that bring protection to people's financial health. And this power, indeed, comes with great responsibility. Over the next years, I have had the opportunity to participate and specialize in the health insurance industry and get to know how some health systems work, not only in Mexico, but also in some other places in Latin America, the USA, and lately even some countries in Asia and Africa. And if there is one thing that I have learned is that in all these places there are still some health access gaps that need to be covered. But at the same time, there are some unique solutions that have arisen in these places that try to address this healthcare access issue. For example, in the United States, self-funded plans and health savings accounts are very common. In other places like in Africa, in Rwanda, community-based healthcare insurance is a pillar of protection, and in India, health microinsurance is common to ensure financial stability in rural populations. I mention this because when we think about innovation, what often comes to mind are these futuristic technologies that could allow us to build these incredibly sophisticated actuarial models. But what if, instead of that, we just paused and thought about the solutions that already exist elsewhere and how these solutions can help us to close those gaps that exist in other countries? At first glance, it seems obvious, right? If something works, share it and replicate it somewhere else. But don't get me wrong. Just as I don't believe that Spider Actuary could accurately model the liability that the Hulk entails, I also don't believe that innovation is just about exporting tools. Health systems are deeply rooted in each country's socioeconomic conditions, labor markets, and regulatory frameworks. What works in one place can easily collapse in another if it is not adapted thoughtfully. For example, a health savings account might sound like a good idea, but in a country where informal work prevails, such a model could even exacerbate inequalities. On the other hand, a self-funded insurance plan in a country where the regulatory framework is not adequate might end up transferring all the risk to the patients. So no, it's not about copying and pasting models, but about offering them as building blocks for something better. And let's not think that innovation only flows from the global north to the global south. Often, the most ingenious ideas emerge from places with limited resources but admirable resilience, like India's microinsurance or Rwanda's community-based health insurance. These examples can and should inspire us to address healthcare gaps in wealthier countries with underserved populations. That's why I believe actuaries can play a very important role in helping to close these health gaps. Not as omnipotent architects of health systems, but as bridge builders. So here's my idea. Let's build a global Actuarial Co-Lab. Not just a database, not just a library, a true co-creation hub. A space where actuaries and other health professionals can collaborate across borders, not to produce ready-to-use ideas, but to create new solutions based on existing ones. Because the true power of actuarial science does not lie solely in the models, but in how we use them to connect and to serve. Thank you very much.
Remember, assumption setting is more powerful than any superpower.